Okay, good afternoon, ladies and gentlemen. It is time for us to call the meeting of the Rutherford County Benefits and Insurance Committee to order. We have on the first item of our agenda approved the minutes of the last meeting. Do we have a motion to approve? All right, Mr. Sandin and Ms. Barnes, seconded. Anyone have any corrections or additions? If not, all of you in favor of that, please say aye. Aye. All right, that's unanimous. Thank you. Now, Mrs. Street, we will hear from you a report on our financial condition.
Okay. Beginning with Fund 264, we'll review the results for the month of August. In our self-funded claims experience, our per employee per month for the month of August ended at $906.94. The year-to-date average is $877 compared to prior year average of $840 year-to-date. When we combine our on-site medical experience, our per employee per month insurance plan cost increases to $943 compared to prior year of $839 for a year-to-date average of $898 compared to prior of $865 for a 3.9% increase. And as we always say this early in the fiscal year, it's still early. We'll see some change we expect throughout the months. Inside of Fund 266, for the month of August, we have a year-to-date of $131,438 compared to prior year of $74,990. And Mr. Good, we're still running about 19 open worker comp. Is that what we're at? Are we below that? 14? Okay.
Does that conclude that part
yes,
of your report? Does anyone have any questions about this 2 months early report? Like she said, we need more data to see what the actual trend is, but so far it's reasonable. All right, that being the case, we'll move on to the next agenda item, and we'll have a report on our workers' comp and OJI. And Mr. Good, you will be giving us that report.
Good afternoon. I'd like to report for the month of August that we had a total of 27 injuries across the county requiring medical attention. You can see your breakout there. The biggest one be struck or injured by. That brings the total for the year up to 146 injuries. Under OSHA recordables, we have 80. Of those 80, 53 were restricted days. 16 had lost time days, and 11 all other. On the next page, you'll see that the dollars incurred for those 27 injuries for the month of August is a little bit less than $27,000. Total was $26,927. Again, incurred dollars can go up if the injury requires additional treatment, or if a claim is closed and has used up all the incurred dollars, those are deducted from the dollars. If you look at the next page, it's a graph that compares this year to the 2 previous years. Out to the right-hand side there, you'll notice that in 2012, at the end of August, we had 122 claims. In 2013, we had 115, and right now we're elevated a little bit this year at 146 claims year-to-date. To see where those claims are, next page you look, the Board of Education had 20 of those 27, and you can see where they mostly struck or injured by, slip, trips, and falls, and strains make up the bulk of those injuries. And the dollars incurred for the 20 injuries are $22,457. The county general had the other 7. Dollars there were $4,470. And on the next page of the report, you'll see that the majority of those claims were in the Sheriff's Department. They had 5 of the 7, and Animal Control, or PAWS, had the other 2. In the last page of your report, Looking at the total dollars incurred this year as compared to the 2 previous years, you'll notice this time in 2007, looking there on the right-hand edge, we had $445,000 this time in 2012 incurred dollars. In 2013, we had $207, and this year we have $204,000. So while the dollars are up, while the claims are up, the dollars are still down for the year. And that just means, I think, that we're reporting smaller claims that are not getting the incurred dollars, but we're all having more claims reported. Are there any questions?
Okay, then, thank you, Mr. Good. If there are no questions for that good report. And next, we will hear from Ms. Perrien regarding our wellness condition.
Hi, how are you? Lori Cook, the wellness specialist at MedPoint Clinic, and I have gone to several Wellness on Wheels lately. We are setting up a table at each school and county department, doing blood pressure checks, derma scans, handing out literature promoting health, as well as trying to increase the clinic utilization. We're handing out flyers showing what services that the clinic can perform, make sure that everybody knows that that $50 copay has been lifted, that anybody can go to the clinic for free now. And we're also talking about the Zincy health assessment to make sure everybody knows about that, and we're handing out the MySignum magnets so everybody has the addresses to take that. And we have had 61 people stop by that Wellness on Wheels table. For August, we went to Blackman Elementary and Blackman High School. The Board of Ed new hire orientations for August was 71 people, and we had 30 people participate with the Healthy Recipe Challenge that we partnered with the farmers market. We told everybody that they could have a $5 token to the farmers market to spend if they would turn in a recipe to us, and that kind of just is promoting healthy recipes as well as their increase for fruits and veggies that they can get at the local market. Lori had one new client for August, but a total of 18 hours for her individual coaching. Our current upcoming activities for October, we are still in middle of the Zincy Health Risk Assessment. That's online. The Wellness on Wheels continues every week through May. We have 2 to 3 a week set up. Our webinar for life services is getting a handle on addiction on 10/21. It's at 11 or 1 o'clock. The exercise portion is where we are kicking off our walking program at the health fair. It starts, the walking program registration starts 10/13. We're going to do a kickoff walk at the health fair on 10/17. At 10/17, we're going to do our annual wellness fair that we will have 12 to 13, 15 free screenings like the mobile mammography unit, the flu shots, allergy testing, etc., that employees can come and bring their families and go around and talk to vendors and do some networking and partnering up there. Anybody have any questions?
Aaron, at the Wellness on Wheels, are you all bringing a provider with you?
Oh, yes. For 1 hour, 1 to 2 hours during the session, MedPoint provider is doing a meet and greet with the staff. So anybody that wants to talk to them, come meet, get a face-to-face, visit with them, then they're welcome to do that. And we're sending the school's flyers with the times listed that the MedPoint staff is there.
So the object of those is, as she said, not only to educate, provide literature and things of that nature, but also to provide more information about what services can happen within MedPoint. If you look at your reporting, you'll see that since the expansion into the retail market, we're averaging about 100 people a month, on average, looking at the last 12 months, that are going there. Those are people that, based on reporting, we probably wouldn't have touched inside one of our MedPoint clinics. So as people become more comfortable with utilizing the Take Care clinics and MedPoint clinics, then we can increase utilization within the employer-owned clinics as well. And of course, that is continuum in the delivery of health care when they use either the retail clinics or they utilize the on-site clinics, and it also helps to control cost inside of the plan. One thing that they have also started doing inside of MedPoint, we talked last month about the telemedicine. They have now done a soft launch of that where employees can actually call in. They've always been able to call in and speak with a provider. They can now actually call in and request to have an appointment with a provider through a phone call. So we are starting to branch off in that avenue to try to find more convenient ways for health care for our employees.
Okay, anyone have any more questions of Ms. Perrien? Okay, then thank you very much. Next, we're going to have a presentation by Ms. Jeannie Herndon from Cigna regarding a program called Your Health First. So come forward and give us some good information here, I'm sure.
While Ms. Herndon's coming up, last month we talked about Zency and the Wellness Initiative, and we talked about why do we do this, and her Your Health First report will show what we are seeing inside of the clinical referrals inside of Cigna in terms of how we are able to take information, do outbound reach outs, or we can take, an employee can call in themselves for assistance, and how we can, what's the next step of obtaining that data, and this will give you a general overview of that.
Hello, everyone. So this is year 2 going into the Rutherford County Wellness Initiative. In 2012 and 2013, I pulled some numbers to show what identification numbers we had before the wellness program started, and then in the current period, the October 2013 through February 2014, I pulled another report to see the increase in identification of employees at risk after that first year of the wellness, the biometric wellness initiative. So what we found is an overview of the chronic conditions, which include, you will see these broken out on the following pages. The chronic conditions includes things like depression, diabetes, osteoarthritis. In the chronic conditions, the current report is showing a 16.1% compared to the base plan of 13.7%. So you'll see that we've increased the identification of people at risk from 13.7 to 16.1 just in that 1 year period. The lifestyle coaching, which is the stress, tobacco, and weight, the base period for that was 1.8% identified with current 4.1%. So that is a pretty good increase of the number of employees that we're able to touch to try and see if we can assist them with in either of those lifestyle problems. Wellness coaching, which includes things like hypertension, preventive medicine, those increased from a 12.4 to a 13.4 in that 1 year period. And then treatment decision support, that is people who are having issues with the coronary artery disease or maybe a knee or hip replacement surgery. Those people may need guidance on what doctor they need to go see, what type of procedures are available. And we touched from the base period, it was at 0.9%, and in that 1 year period, it increased to a 3.4%. So last but not least is the healthy babies, healthy pregnancies. I have on here current 18% compared to a 12%, but those percent signs should not be on this one. We increased the number of participants from 12 to 18. So we increased that 6 participants within that last period. So that's kind of an overview to let you know that the county is doing good on their wellness initiatives. We are reaching those employees and offering assistance. So we just wanted to let you know that that is working. Any questions?
Sure, the HR directors would attest that with their FMLA, we're probably seeing more than 18 babies a year inside of our population. So we did do a postcard mailer on that last year, I believe it was. And basically what that entails, why don't you could probably explain it better than me, why don't you explain to them what that is, because it's important that we may need to revisit that message to our employees.
The Healthy Babies, Healthy Pregnancies program is an incentive type program. If someone is diagnosed with a pregnancy and they call in to register, it's a self-registration type of program, they can be awarded $150 if they enroll in the first trimester, $75 if they enroll in the second trimester. And what this does is it lets those pregnant women have a touch point with a nurse to receive information on having a healthy pregnancy, helps them through the whole entire pregnancy. If they are having problems, they may get more contact points with that nurse. So it's just an educational program that gives them direct access to someone to help them coach, other than their OBGYN, of course. But this is just a contact on the phone that can help them through their pregnancy.
Is it a 24/7 nurse line for them as well? So if they're having questions or concerns, they can contact them to see, is this something you think I should call my doctor about?
Yes, yes. Mm-hmm.
Okay. Mr. Hall.
The biggest numbers were depression and diabetes are all groups kind of, they're twice what everything else is on there. Is that normal for most groups that size, or is that this size? Or is that
I don't know compared to other government accounts. I mean, I think that is a pretty high number. And when we look for wellness programs for future, we do look at these numbers to help us determine what programs we need to target. And yeah.
Questions? Ms. Herndon, just as a bit of a clarification here, it's not necessarily that we have more people that have these conditions. We're identifying them in increasing numbers, so that now we do have an opportunity for those folks that we've identified to pay attention to this and do something constructive about addressing those. Is that what it's about?
That
the people
is
were already
absolutely.
there. We're just now finding out a bit more about who they are. They are themselves.
We're just now finding out more about the population of Rutherford County, because last year when they had those biometric screenings, the claims were submitted to Cigna. Cigna takes that information, feeds it through our analytical engines, and it gives us percentages of at-risks for certain companies. So yes, that does not mean that you have more people that have these problems. It's just that we are now able to identify them better and reach out and offer assistance with programs.
But doesn't it, though, Ms. Herndon, doesn't it show that those conditions may have been prevalent but not identified by the individual yet, and the biometric screening assisted in doing that? Because all of the claims data is already feeding into this system prior to Year One Wellness Initiative. But had they never had a biometric screening or some of those services, there wouldn't have been a claim to actually feed into Cigna for identification. So some of the increase would be directly related to that. Is that a true statement? Okay.
Anyone else have any comments or questions on this? All right, then, thank you very much. All right, Mrs. Street, the agenda item that says announcements, who's going to be doing that?
That would be me. I'm going to probably just combine these three together to make it simpler. This is the envelope that will be mailed October the 2nd that contains the open enrollment materials. We think that this is probably one of the best marketing looks we've had so far, so we're really proud of it. Inside of that, employees will have their enrollment guide, which they typically see. It will also have the what's new. We always direct people to page 1. It talks about what's new. One of the big things for this year is employees will have to register for vision benefits. So unlike where it was embedded previously due to healthcare reform, it is now carved out, and employees will have to select whether they want medical, whether they want dental, or if they want vision. So that is one thing. The flu shots, as Ms. Perrien alluded to, the flu shot flyer is included in that packet. The first date will be at the Wellness Fair at the Lane Agri Building, which is October the 17th from 3 to 7 p.m. We typically do near 1,000 shots there. Is that correct? Somewhere about 700? Okay, well, I must think there's more people there. She's saying more like 400 or 500. Overall, I think we did about 1,500 last year. There's also open enrollment meetings this year, non-mandatory. There will be those dates included for them, as well as the wellness information for year 2. You know, what do I need to do? Year 2 and year 3 is also included on this flyer, so they'll know what the requirement is beginning January 1 as well, which is a little bit different. We have had meetings inside of the schools, as well as a couple of meetings so far here for County General. We have experienced about 450 plus school personnel that have come to these meetings. Ms. Barnes has been tremendous in helping us coordinate that in the schools. The principals have been very good about getting employees there, so we greatly appreciate that. I received a report from Cigna on the 15th of this month that showed that out of the 9,965 eligible, we've had 2,345, or 24% complete. So, and we're still in the soft opening phase. Once these packets go out, once the meetings conclude, you know, this is really our ramp up period. We did add a couple of meetings over at the sheriff's office for sheriff office personnel to come to. So, and we are going to train all the directors and the elected officials who attend the morning meeting with the mayor on Tuesdays of each month. We'll be training them as well. So we're trying to get the word out as best we can. The open enrollment period will be October the 20th through November the 3rd. Begins at 8 a.m. on that Monday, ends at noon on November the 3rd. As I said, the packets will mail out on October the 2nd. And the only exception to that will be pre-65s and post-65s. The retirees have a little bit different enrollment period this year, and that is because of the new option available for the pre-65s with the $500 or adequate rate stipend that we are doing. We are going to have meetings November the 5th and 6th over at the Annex building, is that a proper word for that, of the central office. And we will send out postcards about that, as well as letters advising them where we can educate them about the new option for pre-65s. And then if they have interest in exploring the health exchange, there will be people there who can assist them with that as well. And then their enrollment period will be November the 5th through December the 1st. Anything else you want to add, Ms. Anderson, on those? Okay. Yes, ma'am. They will do flu mist. The flu mist is going to only be available for children ages 3 and under due to availability. Yeah. Okay.
Okay, does anyone else have any announcements or questions or comments? There's a note on my agenda that says there will not be a meeting in October. Our next meeting will be November the 20th. All right, if none of you have any other business you want to bring before the committee today, thank you very much for your attendance and participation, and we are adjourned. Thank you.